Hello, and welcome to this Royal College of Surgeons of England webinar on Wellbeing and You. We've got some great panelists. I was just saying how great it is to have a wide variety of people from across the medical spectrum, because we're all grappling with different things. And I think over the last year, people have been working in different teams as we've never really done before. So it's lovely to get experience from the psychiatry angle and the BMA and one of our own, Martin, which is great. So I was going to kick off with a few justifications for me being here at all, and then launch into the kind of main event. So have the first slide, please. Imna, can I have my first slide? Thanks. Bear with us just a moment. I've only got a few slides myself. There should be one just saying me. There we are. Here we go. So that's my first slide. My first one actually said I'm Mrs. Scarlett McNally, consultant orthopaedic surgeon and council member here at the Royal College of Surgeons of England. And I just wanted to kind of reiterate that there are multiple organisations dealing with the wellbeing of doctors. The GMC produced a report 2 years ago now, Caring for Doctors, Caring for Patients, and they commented on the need for autonomy or control, belonging and competence, ABC. And in fact, the competence wasn't just competence, it was being confident in your workspace and having enough time to do what you wanted to do and that kind of thing. But so ABC. And just this week, the an alliance of dental practitioners have got together with a mental health wellness in dentistry. So I do urge you to look at that if you're interested, mhwd.org. And they've got a large strategic oversight group of all the dental care professions and a large number of supporters, which you probably can't read, but you know, the General Dental Council, Royal College of Surgeons of England, Royal College of Surgeons of Edinburgh, and everyone is supporting that. And it's basically about recognising the importance of mental health. My next slide, please. So my next one's going to talk about exercise on my next slide. And this is something I've been very involved in. I've just come back from a bike ride. I thought I've been looking at a computer all day. I can either nip out for 45 minutes on my bike, which is fantastic, or I can get another thing done and then come back. So I went for the bike ride option. And this is why we do anything, the kind of brain chemicals. So dopamine, you've got to set yourself some goals, have some little mini rewards. It's the same stuff involved in procrastination, thinking you'll do it later, and actually later never comes. There's something about serotonin being included. So if you sign up for a charity walk or run, you're far more likely to do it because you feel part of a gang and you're doing it for other people, which is the oxytocin as well. And the endorphins take a while to work. So I always encourage people to, have your running shoes by the front door, have everything ready and prepare for failure. Next slide, please. So I was lead author for this, Exercise, the Miracle Cure. And we had some stuff in the back of it about how to really start talking about exercise with patients, because it really can make a difference. You can reduce your risk of dementia 30%, depression 30%, bowel cancer 45% just with regular exercise, and it treats many common conditions. But this I picked up because I didn't know that much about it before, about if you want to change behavior, it's about setting yourself a goal, understanding the reality of what it's like and what's holding you back, and then options, what might work for you, and everyone's a bit different, and then what next. So that's grow, how do you keep it up, kind of thing. And then you can increase, once you've started doing something, you then increase frequency, intensity, time and type fit. And I do urge you to look at the resources on movingmedicine.ac.uk. That document there, Exercise the Miracle Cure, is on the Academy website or my own website. Next slide, please. And the other thing we need to talk about is kind of connections with other people, because that's really important. And the NHS is full of bad interactions. And again, the college has done as much as we can, or not as much as we can. We've started doing as much as we can. So I've just put 3 things up there, some of which you can get on rcseng.ac.uk/study. So avoiding unconscious bias, kind of not saying the first thing that comes into your head, not making an assumption about why someone's doing something, but trying to greet them with positivity and setting some clear rules about what you expect. So please, everyone, read that. The one in the middle is very new, managing disruptive behaviours in surgery. And I think some people are so busy with what's going on themselves that they have bad behaviours, to put it politely, and we need some way of dealing with something in the moment, so that it's professional in the moment of, oh, you can't say that, can we talk about this later, or something, just some way of stopping something in the moment, and then maybe someone needs to ask them if they're okay later. But again, do read it. It's new advice and working out what's crossed a line and what the level of insight is, whether it's persistent, whether an intervention is needed, but you don't have to fix everything straight away. And the other thing is about how we come over to other people, such as students and new staff. And that book is about learning in the operating theatres. Often you get stuck in kind of what you think is normal for you is really different.
Scarlett,
That's going to do it. Make a plan for failure. Yes.
Sorry, it's Jane. Your audio just went, so we missed everything you said in the last 2 minutes. I'm really sorry.
I'm so sorry.
No, not at all.
Don't worry, it was all in the pictures anyway. I was saying, look at the stuff. Thank you, Jane. So yeah, value each person, rcseng.ac.uk/study, and kind of acknowledge when you're stuck in the moment, acknowledge it. And so that you don't come over badly to other people, because we're all part of the same team, and notice when other people are kind of stuck in their own moment. And the other thing, my little top tip, be kind for your future self. What advice would you give yourself? We're very bad at looking after ourselves. So anyway, that's enough of me. So we're moving on to the panelists now. So we've got Mihaela Bukur, who's a consultant psychiatrist specialising in general adult psychiatry, working in Linwood, Sussex Partnership NHS Foundation Trust. And she's also the Associate Registrar for Wellbeing and Retention and Chair of the Wellbeing Committee at the Royal College of Psychiatrists. So you're very welcome, Mihaela, and we're looking forward to hearing what you've got to say. Thank you.
Thank you very much, and thank you so much for inviting me to be here. It's an absolute privilege to be here with you and also to discuss about workforce well-being. Next slide, please. So I'm going to highlight in my brief talk a few aspects related to well-being, which I really hope you'll find helpful. I'm going to start by saying something that is quite evident. Well-being is a broad concept. It's something which is not easily defined, and therefore is something that is not easily measured. For a start, well-being means something different to each of us. It has at its core this concept of life satisfaction, getting meaning from what we do, being able to contribute to the wider society, being able to form and maintain positive relationships with the people around us, but also being able to self-accept ourselves, particularly when things are difficult. Next slide. Well-being, next slide, please. Thank you. Well-being is also dynamic. It's influenced by so many factors which interact with each other in such a way that they determine how our state of well-being at a particular time in our life. Health is an important parameter, but other factors are important as well. And some of those that are included here are, as highlighted by the Office of National Statistics or by What Works Center for Wellbeing, who does a lot of research in relation to population well-being. So apart from health, other factors influence our well-being, our ability to learn and develop across the lifespan, work and workplace, so important, our natural environment, the state of our finances and the state's finances and the state of our economy. Working and living in a place that values the principles of equality, diversity and inclusion. Our activities, the relationships we have with others, It's also influenced to a certain extent by our own personal history, the challenges and opportunities we had, and the support we received on the way, and how our resilience was shaped in that respect. Next slide. If we are going to narrow the whole concept of well-being and particularly focus on well-being at work, I'm sure that we are all in agreement that we all face stresses in our day-to-day at work. It's the nature of our job. But when this stress becomes chronic, when it's poorly managed in the organization where we work, where, for example, we have a high level of responsibility with very little autonomy or ability to influence, when you work in a toxic environment or with limited resources, we are more likely to suffer the adverse effect of chronic stress. And they come in different forms: burnout, depression, anxiety, post-traumatic stress disorder, or engaging in an unhelpful way of coping with chronic stress, like substance misuse. Suicide is increasing in the medical profession in comparison with the general population. So apart from the personal costs, there are also implications for the care we deliver. The research shows that doctors suffering from burnout are more likely to make mistakes, are more likely to receive unfavorable feedback from patients. Productivity decreases. And along with this, there is a financial cost for the organizations. Next slide. So in an already overstretched system, I would say, COVID brought additional difficulties or accentuated some of the things that already exist. We all experience overall increased pressures of work, but we had additional challenges, concerns about risk to our own health or about the health of our family, the people we have at home, some of them vulnerable. We are concerned about families which live abroad, particularly for being relevant for the international graduates. We all know about the harrowing situation in India and the great concerns that colleagues have about the state and welfare of their family and loved ones there. All this impact on how we feel at work. Also, the pandemic brought at the forefront the increased vulnerabilities for colleagues from Black, Asian, and minority ethnic background. We are more likely to have an increased workload during the pandemic, to have our job roles to be changed. Some of us had to shield at home and work remotely, sometimes isolated and not with the right resources or with the adequate resources. So overall, the emotional distress, including burnout, was made worse during the pandemic. It was a lot to learn in terms of the challenges we had. And also it was a lot to learn when we found practical solutions to the difficulties we had. So now we need to focus on recovery. Next slide, please. So we discussed up to now how complex the area of well-being is and how poorly defined is to a certain extent, and how someone is unique in terms of their challenges and opportunities. So one solution is not going to fit all. So we need to look at different aspects which may contribute to keeping us well. Or sometimes when someone's well-being at work is affected, it's not usually easy to pinpoint where the stress comes from. It's usually a combination of different things. There are things at work, there might be things at home. So the Royal College of Psychiatry is to have an established well-being committee, and before we embarked into defining our strategy in relation to supporting the well-being of doctors working in psychiatry and the well-being of their teams as well, we took some time for reflection, and we looked at well-being as a hierarchy of needs, things that need to be fulfilled in order to enable us to thrive at work, to experience joy in work, to be able to find creative solutions when things are difficult. We have been influenced in developing this model by the work of the prestigious American psychologist Abraham Maslow, who developed the well-known hierarchy of needs related to accomplishment and human development. So I'm going to go very briefly now into some of those needs, as illustrated here in this pyramid of needs. So let's start with the basics. I guess in the medical profession and in general, one of the most basic aspects is to give an honest answer to the question, am I well enough to work? Do I need support? I guess It's challenging for us and as doctors because we struggle with a high level of stigma and prejudice in relation to asking for help. We are concerned about confidentiality, the impact it's going to have on our career. We are concerned about how we might be judged, not only at work, but at home, in our society, in our communities. So we're more likely to delay asking help at the right time. But asking for help is not a weakness, it's a strength. It's important for our health, it's important for the work we are undertaking. And there are many resources available there. I know Mary is going to discuss in a moment about the BMA resources, but along with this, there are, of course, our own occupational health departments in different trusts, our own GPs, or also more specific services which look at the particularities of stresses in healthcare, like, for example, the NHS practitioner health service. Another basic is the need for self-care. Considering that burnout in medical profession almost reach epidemic proportion, perhaps self-care should be our first lecture in medical school. Perhaps a reminder of the importance of self-care. It should be something that we discuss during all the transitions from one career stage to the others. Stressful times for all of us. So the importance, and Carla has highlighted earlier, the importance of simple self-care habits cannot be underestimated. They can have a massive difference. They have such a huge impact. Physical exercise, adequate rest, nutrition and hydration, adequate, particularly in the context of working long hours, but also social relationships, activities that gives us joy outside work as well. So another basic one can consider having a double job plan. A job plan which actually highlights the realities of our workloads, the ever-increasing workloads, the opportunity to have a job plan discussion which acknowledges the fact that as humans, we all have a limited potential. So we can do well with the resources we have. So we need to be supported in that respect. Let's move to the next need, the need for safety. We need to feel safe at work. And during the pandemic, we discussed, and it was so relevant to focus on, for example, PPEs and feeling safe at work, where we spend most of our time. But safety goes beyond that. It's also about psychological safety, working in an environment where compassion is at the forefront. Safety also means having access to supervision as a trainee. And also, even as a more senior doctor, to have the chance to reflect on a very challenging case with a team, with the peers. Safety also means having the right support at work when we come back after a period of being off, with stress or with mental illness, or with any other type of condition. Recovery doesn't stop the night before we go to work. It will continue. And how we are supported at work will actually shape our reintegration in a safe way, will actually influence if we remain in that job. Belonging, the need for belonging, so important. Belonging to our team, but also belonging to our wider professional community. And doctors can feel and can become very isolated in a busy environment with many people around because of the intensity of the work, the numerous tasks we have to finish in a limited time. So fostering the sense of belonging during at work with our teams and also with our peers, it is very important. What about feeling valued? Very important as well. Feeling valued and respected where we work, it has such an impact on our well-being. And actually, the lack of that has many implications for developing burnout. So being valued and understood also means being able to contribute, sharing our views when we look at developments in the area where we work. But sometimes feeling valued also means the team or the place where we work being aware of the extent of our knowledge and skills in such a way that the time we spend at work is primarily focused on bringing this at the forefront. For example, we know that the increased administrative tasks sometimes will have an impact on the time we spend with patients or take us away from time where we can use the skills we have been trained for. The feeling value will also include support in relation to administrative tasks. So this is just an informal modality which can help with personal reflection. Also on one side, when someone already struggles with stress, but also before, thinking what things are important. It can also be a guide for conversation with a colleague. Talking with someone who is stressed is never easy, and also for discussions in the team. Next slide. Thank you so much. And if I have to synthesize from my experience as a psychiatrist, but also working at the Royal College of Psychiatrists on wellbeing, I think there are three important things that I learned make a huge difference. Stay connected, be kind and compassionate, and particularly develop the ability for self-compassion. And very importantly, ask for help if you struggle. Thank you.
Brilliant. Thank you, Mihaela. That was really good. Thank you. We're going to move on to Martin King now, who's the current Vice President of the Association for Surgeons in Training for the UK and Ireland. He's recently completed core surgical training and is due to start ST3 general surgery in Northern Ireland in August. And between now and then, he's working full-time as a postgraduate medical education fellow to the Southern Health and Social Care Trust. So Martin, you're very welcome. Far away.
Thank you, Ms. McNally. Thank you for the introduction, and also to the college for the invitation to ASIT at speaking at this evening's webinar as part of Mental Health Awareness Week. The theme for Mental Health Awareness Week 2021 is nature, and in anticipation of speaking tonight and from personal experience, it is clear that connecting to nature has positive impacts on our mental health. But fundamentally, why is it important that we have a Mental Health Awareness Week, and why is it important that we speak on well-being tonight? Well, firstly, I think it's important to understand where we started and what we have come through. Each of us will have our own memories of the 16th of March 2020 when Prime Minister Boris Johnson announced the first lockdown in the UK. And COVID has brought many challenges to all of us across society. We all have had to endure limitations on our contact with family, friends and colleagues, all but for the essential reasons. And some of us will have battled the disease itself, lost loved ones, and particularly in tonight's audience, some of you will have held the hand of the COVID patient in their hour of need in place of their friends and family. These are and will just be a few examples of many heartbreaking stories that will continue to come to light in months and years ahead. But the stresses and strains of COVID that is placed on each of us individually reflect the challenges of delivering care amid a global pandemic. And we must remember that pre-COVID, health services were battling to meet the demands of our aging comorbid population, and the pandemic brought to the fore the vulnerabilities of the stretched system. As an integral part of the overall healthcare workforce, surgeons and surgical trainees have played a crucial role in continuing to deliver care to patients throughout the pandemic. Trainees have done so whilst making many sacrifices, personal and professional. Some of you will have been deployed to ITU, to the front line and other departments, all at short notice without the knowledge for how long for. ASIT, surgical trainee specialty associations, alongside the Royal Colleges and other stakeholders, recognised from the outset that the reduction in surgical activity would have far-reaching consequences both in the short and long term for patients and surgeons alike. In April 2020, the trainee organisations made a commitment in a joint letter penned to act collaboratively across all grades and specialties. It emphasised the importance that would be placed upon the trainee voice being represented at the highest level. The pandemic cast uncertainty on recruitment, examinations, fellowships to name but a few, but trainees continued to answer that call for help. Following the statement, a pan-specialty survey was commissioned called COVID Star, of which I'm sure some of you have heard before. The impact on surgical training and the recovery planning, which truly sought to qualitatively assess the impact during the first wave back in May 2020. It focused on redeployment, training, teaching, education, and importantly, health. The results painted the stark picture of difficulties encountered by you, the respondents. 41% were redeployed, 82% of you on an involuntary basis, and for 20% more than 2 months. The positives to come from that is that the majority of you felt supported in your redeployment, but there was a differential impact on the grade of the doctor redeployed, and the majority were our junior workforce, our foundation and core trainees, which are the future. 80% of respondents had courses cancelled, and fundamentally, almost over a half had greater than 50% of your training activity reduced. This made huge changes had to be made to the ARCP process, with derogations introduced to mitigate for the impact on training. With the JCST and the other educational bodies, as of March 2021, it's predicted about a quarter of surgical trainees are on an outcome 10, meaning that there will need to be potential increased training required to meet competencies. And worryingly, 1 in 8 of ST8 trainees in their final year are thought to be an outcome 10.2. On a personal level, I reflect on those statistics at that time. In March 2020, I was a CT2 working in trauma and orthopedics. My MRCS was cancelled. The trust that I worked in created a pan-grade, pan-specialty surgical rota. Training had come to a standstill as multiple departments and specialties joined forces in a fight against the pressures of COVID. Training became extended, and like for many, I feared for health, whilst at work, career and job prospects. But when that survey was undertaken back in May 2020 at the first wave of the pandemic, still then there was a significant impact on our well-being. 73% of people felt that the pandemic had negatively affected their well-being. Half had felt that it affected their physical health and personal relationships. And interestingly, 3.3% of respondents reported to plan to leave medicine altogether. Unfortunately, the problems haven't gone away, and the results of last week's BMA Impact Survey in April 2021 report that 1 in 5 doctors plan to leave the NHS. What is clear is COVID has had a significant negative impact, and in light of this, these sacrifices will be factored and should be factored into the rebuilding of services. So where are we going to? We have seen and read the headlines. There is a significant amount of work ahead, epitomised in the recently published London School of Economics and Lancet Commission on the Commission of the Future of the NHS. That data has shown that a decade of progress in decreasing the waiting times was erased in a matter of weeks in March 2020, falling from 80% down to 47% of patients waiting less than 18 weeks to start treatment. Regardless of the challenges that lie ahead, and with tonight, we need to look after each other. We need to be kind to one another. The focus across organisations and healthcare and teams will be different as we rebuild services. In those teams, we should ensure that we remain mindful that each of us has had an individual experience, and each of us will have had different pressures and face new pressures in the rebuild. Some of us will be focused on our waiting lists. Some of us will be focused on our training needs, and others will find it hard to maintain the same energy as committed to in the last year. We are all unique. What has happened is the pandemic has been a pause and a reason for us to reflect on how we train and how we work. I know that, like many of you, you'll be zoomed out after this year, but there's a positive from that, in that it has brought us together in a unique way, and we need to maximise that. Going back to the theme of Mental Health Awareness Week, take the moment to enjoy nature this week. Make that call to your friend that you've lost touch with, but importantly, keep safe and be kind to yourself. Thank you for the opportunity to speak tonight.
Thank you, Martin. That was really good, and it's lovely to hear one perspective and to know that there are so many more out there. So yes, thank you very much. And can everybody who wants to raise any questions just start thinking of them and putting them in the chat while Mary's speaking, please? So we're going to move on to Mary Meekings, who's the British Medical Association's Wellbeing Support Services lead. She's worked for the BMA for 4 years and doing her current role since January 2020. She's overseen the BMA's wellbeing response to the pandemic, and she's worked to build easily accessible wellbeing services for doctors and medical students. She also chairs the planning committee for the International Conference on Physician Health, which recently brought together 800 doctors from around the world to share their learnings and experience of improving the working lives of doctors. So Mary, you're very welcome. Please go ahead.
Perfect. Thank you so much for that introduction. I think everyone at the BMA has been overseeing our response to wellbeing this year, in terms of it just being such a massive focus. So it's really such a privilege for me to be joining this panel today to come and speak to you. I think where I really wanted to focus my talk was on our wellbeing support services. So that's what my team at the BMA are looking after, and obviously hugely focused on during 2020 and now 2021. So I'll be giving you an overview of those services. I'll talk a little bit about the impact of COVID-19. I think it won't come as any sort of surprise to this audience at all in terms of what you might see there, but you might just be interested to see some of the statistics in terms of doctors and medical students presenting to our services. I'm also going to take the opportunity to mention a new offer we have in terms of face-to-face counselling, which is something that we've not been able to do before at the BMA, but we have just launched. And also something I'm really mindful of is, obviously in my role, I'll talk about what the BMA are doing, but there are so many other organisations out there who are really committed to this common cause that we all have. So I'll also just talk about where you can find some of those other services. I don't know if you can hear in the background, my children are having their bath. I can hear them. So if you hear them, they're absolutely fine and they're very, very safe and being looked after. Can I have the next slide, please? Thank you. So just to give you a real summary of the services that are available through the BMA, I think listening to the other speakers, I think it's always really nice to put this into context. So the services that we have here, they're not a silver bullet, you know, it's not something to come and solve all problems. And I'm really, really mindful that there's so many other things that people can be doing for their well-being and other strategies that have been so expertly shared this evening, but I really hope there is a place for these services within that. So first of all, we have BMA counselling, which is accessed through an 0330 phone number, and it's accessible 24/7. You know, we never close that service, it's always available to you. And I think what's really crucial, and I really want to get this written on a t-shirt, our services are available to all UK doctors and medical students. So I think obviously it's a common misconception that you might think you have to be a BMA member to access these services, and most of the services that we do run at the BMA, absolutely you do need membership, but for our wellbeing services, you might have spotted in my job title, part of what I do is around the BMA social responsibility, and I think we almost position our wellbeing services as it's not something we want to sort of put behind a paywall, it's not something that you need to pay to access, it's completely free, and for that reason it's not restricted to our membership. It's not even restricted to you as doctors and medical students. We also have opened up these services for your families. And I think that's something I've really reflected on in my role in the last year is, I keep saying this, but doctors happen to be people and they have a home life as well as a work life. So your family's well-being is also extremely important to your well-being. And I think opening our services up to families really recognises that. So BMA counselling is available by telephone and online, and in the last week of April, so just in the last couple of weeks, we've just introduced face-to-face, which I'll talk about a little bit more a few slides in. The other service, another service that we run is the BMA peer support service, and this gives you the opportunity to speak to another doctor. So while the counselling, you will phone, and the phone is always answered by a counsellor, and you'll speak to a trained counsellor. With the peer support service, this is the opportunity to speak to another doctor. And what we hear all the time, I think I hear almost every day from doctors at the BMA, is just that context you're working in is so unique. So having someone who understands that context, understands the environment you're working in, can be really helpful. So this gives you a real listening ear. So it's not counselling, it's quite different, so that's something that's quite distinct. So that's our peer support service. The next service down the list is the GMC Doctor Support Service. So we work really closely with the GMC, and the GMC actually commissioned the BMA to run this one. And this service is for any doctor undergoing a GMC investigation who, again, might just need emotional support while they're going through that process. And I think the benefit of the BMA delivering that through our doctors is, again, just that real understanding of what that might be like, which I think you might struggle to get from someone who's not a doctor. So again, it's that peer, it's very similar in terms of how it's run to the peer support service, but with the GMC service, obviously the people who work on that service are given that extra layer of training so that they really understand the sort of GMC processes and sort of what we might be going through there. We also have Doc Health, which we run in partnership with the RMBF, and Doc Health is a psychotherapy service. So a little bit more involved and in terms of the sessions compared to our counselling service. And it might be that you start with BMA counselling and then you're referred for psychotherapy if that's appropriate. And the last thing to mention is that sources of support. I do have a slide later on about this, but I just think it's really important to recognise that there are so many sources of support out there for you. Something we hear a lot is people worry about confidentiality. So we all know that, you know, the medical profession, we all bump into each other all the time in different spaces. And you know, that is obviously more so for doctors if you've trained together, if you're in certain speciality. So that confidentiality is really important. So I think having a really broad range of services is really important so that people have that choice and that they can access something that they feel comfortable with. So if I could have the next slide, that'd be lovely. Thank you. So just showing the impact of COVID-19, I think I mentioned in the very lovely introduction that I joined the Wellbeing Support Services team in January 2020, initially covering someone's sabbatical. And the introduction I gave to it was this really lovely team to be joining, quite quiet, nothing too much happens in the Wellbeing team. And as you can imagine, a few months in, that picture started to change. That said, in April 2020, when, you know, we can all think back to what life was like then, we actually saw a reduction in doctors presenting to our services. And it was quite interesting because we at the BMA had spent the previous sort of, you know, as soon as we sort of knew about this pandemic coming, like really gearing up and making sure that we had real access to these services in terms of, you know, just making sure that we were ready, really. Then in April, we were kind of looking at each other like, where is everyone? They didn't come. And I think, you know, you will all know better than me in terms of what was happening at that time. I think that, you know, that analogy of sort of everyone climbing the mountain together during the first wave. And it was actually when we started coming out of the peak that we unfortunately started to see more people presenting to BMA counselling. And you can see from the bar graph what happened for the rest of the year, really. So just for the rest of the year, I felt like every month I was saying, oh, it's gone up again, we've seen more people, and that just continued, really. And then last month or 2 months ago now, but in March 2021, we saw a real spike. And again, I think that is the coming out of the peak seems to be where people were really struggling and then really looking to access help. So that's a very broad narrative. Of course, there's so many different bits and pieces going on in there, isn't there? But I think that's sort of broadly what we saw across the rest of the services as well. And when I speak to other service providers, they tell a similar story. The next slide. So we collect a lot of data as much as we can. Obviously, when people come to our services, we don't want to overwhelm them with that in terms of asking lots and lots of questions. So, but the data we do have is very interesting. I've just picked out this gender split because I think it just tells an interesting story, really. So while that looks quite stark, so this is the percentage of males and females who came to BMA counselling over the last year. a lot more females are coming forward and seeking help, and I think that's almost received wisdom that's a normal trend. But interesting, that's actually down on the previous year. So the previous year we had 75% female to male. So statistics are what they are, aren't they? And how much can you read into them? But I think it's probably, for us, it's always been something that we've wanted to improve in terms of encouraging more males to step forward and seek support. And I think that might be something that we see from the pandemic, as we are having these great conversations with this panel this evening, that more people are encouraged to come forward. So I hope we continue to see that. And next slide. Thank you. So just to mention this new face-to-face offer, really conscious that face-to-face, really, are we doing that already? But I think it's something that is important. I have been so delighted with actually some of the gains that we've made online in this format that we're speaking to each other this evening, and we all hope, I think, that we can continue some of those. So a huge one of that is just accessibility. So we've been able to see so many more people who are sort of in remote areas or fitting in their counselling session to their life without having to travel to do that. So I think there's a real place for that, and I think moving forward, I think there'll be a bit of both. But at the same time, that we have had people coming to us and saying, actually, you know what, that drive home from when I had my counselling session, that's when I did most of my work or most of my processing, and that was really, really helpful. So that, some people have been missing that face-to-face interaction with their counsellor. So we were really, really fortunate to benefit from some funding from the COVID-19 healthcare support appeal, and that's helped us put in this face-to-face extension. So this isn't something we've ever done before, so it's not something that we had up and running before COVID and COVID stopped. It's a brand new service that the BMA are now able to offer. So while we had counselling and online support before, we will be able to now offer face-to-face counselling for all UK doctors and medical students, and all the accessibility applies to what I said at the beginning of the presentation. So that means that it's always available. It's available to everyone in the UK, for doctors, medical students, and their families as well. So I'm really hopeful that that will be an extra thing. If that's something that people have been struggling with in terms of not being able to have that face-to-face contact, that's something that we'll be able to do in the coming months. And as the restrictions subside, we'll just be able to add more counsellors to that network so that we have better and better coverage. Next slide, please. Oh, thank you. I was worried there wasn't a next slide. So this is our other sources of support. So that actually should say NHS practitioner health. So it's a really large service. We work really closely with that team. In terms of people always ask, like, well, how do you work together? What does that actually look like in practice? And what we're really doing is we refer to each other. So it's almost like added capacity in our network, and we just make sure that we're really, really closely in contact. So that's a fantastic service. I'm obviously here promoting the BMA, but I would just encourage anyone to seek support where they best think and best suits you. Likewise, in Wales, there's Health for Healthcare Professional Wales. If you're in that area, or if you have colleagues in that area, I think that's another really important message. So many people who come to our services will say they got there because their colleague recommended that they do that, or that they shared their story. So yeah, I've just included the sort of Wales and Scotland services here as well, just in case you know someone in those areas who are looking for support. And then especially over the last year with COVID, we've had so many new services popping up in response to what people could just see happening around them and wanting to help, and the real demand for support. And we really, really welcome that and want to work with people who have the same aims as us. So what we've done is we've put together a wellbeing directory. So if you're not sure where to start with all of this, I think that's a really good place to go to, so that you can see all the services listed, you can see what's local to you, or, you know, as I say, local to your colleagues, which I think is really, really important as well. So yeah, thank you.
Brilliant. Thank you, Mary. That's really helpful. And you put up the links there for bma.org.uk to get to see. And again, it's about friends, family, colleagues, and everyone. So we're working together, and it's amazing how these services have grown and developed. Well, really well done. We've got another slide. Questions now, and then I was going to tell you about that we've got a College of Surgeons support service as well, which I'll give details of right at the end. So Jane, do we have any questions for our speakers?
Hi everyone, and thank you for joining. We have got a few coming through already, but please do keep sending them through. And just as an admin note, we will after the event tonight, we will send an email and include some of those contact details and links in the email, just to make it a little bit easier for people to click through if they do want to approach anybody. So kicking off with the questions. This is for all of the panel, it's come through, so whoever has anything to say. Do you feel that the lessons that we've learnt during the first 2 waves of COVID will help prepare surgeons for the next sort of set of challenges that they're facing regarding backlogs and waiting lists, and hopefully no more surges, but any potential future sort of pressures and surges that might come along?
Shall I leap into this one and answer in a slightly unusual way, because I've got another role as a Deputy Director for the Centre for Perioperative Care, and that's about getting patients through the whole journey from when an operation is contemplated to full recovery afterwards. It's based at the Royal College of Anaesthetists. And I think one thing the pandemic's kind of reinforced to the public is sometimes healthcare, sometimes the NHS can't fix everything, and sometimes people who've got other things going on have sadly have a worse result. So what we've been looking at is ways we can get people healthier for surgery. So it's like a preparation list rather than a waiting list. And it's all the same things we've been talking about, you know, getting some exercise, eating well, getting some sleep, reducing alcohol, that kind of thing can reduce complications about 50%. So we need to kind of get the systems in place so there's surgery schools, so people aren't cancelled. We're looking into frailty and anemia and diabetes so that those are managed properly, and so that people, when the patient comes to surgery, they are as good as they can be, and ideally as a day case, so you can use a geographically discrete area, and that will also help getting help the well-being of the staff, because if you're actually doing good work and you know that it's going well and you've got a good team thing going on, it works really well. So that's what we're working on, but it's slightly peripheral to what we're saying. Martin, have you got any ideas on that?
I think, again, from a personal example within my region in the UK, and there's similar practice, is the way that we deliver services has changed, and I don't think it will return. There's been stronger communication across the organisations in different areas that wouldn't have necessarily been as easy prior to COVID. And I think in answer to the question, the first 2 waves have been a catalyst that we really need to support each other. We need to maximise kind of everyone in our team. There is a huge amount of workforce out there that are ready to start delivering services that have been hugely restricted in the first wave, particularly, and even more so in the second wave. But I think now what has happened, we've had regional prioritisation groups where we collectively speak in the country as to our cases that are most important. But we've had a significant backlog, as you've seen, in elective and other non-red flag activity, which from a surgical training point of view is bread and butter cases that we require to train the next workforce. And I think collectively, kind of what we've learned is that we need to be more open at all times in the healthcare setting, particularly in theatre, that what everyone's role is, and that is both for the patient and both for the trainee, and also to be mindful of the impact on our nursing staff and the extended surgical team, because they have been redeployed. People will be coming back to their normal place of work, and I think what we've learned together is that we can get through the challenges of COVID, but we also have to be patient. Not now in the third wave. So I think we've learned a lot, both from a non-technical aspect, but also now we have to focus our efforts on each other as well as the patient.
Thank you. So
I
Jane,
momentarily lost my mute button then, which is a bit embarrassing after nearly 18 months of running webinars. So sort of on this sort of similar theme, historically, I think everybody here is probably aware of the fact that surgeons were not the greatest for asking for help. I think that's played out in some statistics that we've seen in previous sessions. Do the panel think that, excuse me, the sort of challenges of the pandemic and just time in general accessibility is going to improve the uptake from the sort of surgical workforce? Because I know, like I say, pre-pandemic, historically, we were not the greatest asking for help, I think is safe to say.
Mary, do you have statistics on which specialties come to you?
We do actually, yeah, and I have to say we should be speaking here more often because we don't get surgeons are very underrepresented in terms of the statistics that we see. I would say though that I think there is something in that in terms of when, particularly last summer, the people that were presenting to the services who were coming, COVID was mentioned, and it was almost discussed as this catalyst for why they called or why they'd come through to one of our services. But I think what our counsellors were saying, and even the peer support doctors were saying, is that actually I think this person should have come a few years ago. So COVID was the thing that made them pick up the phone. But actually, I think that people could have benefited from reaching out and asking for help earlier. So, you know, as we, always say, like, if we really wish the pandemic hadn't happened, but in terms of just taking what we can from it, I hope that those sort of help-seeking behaviours do become embedded in the profession, and that's something that we can take as a positive.
Thank you. Another question, Jane?
So my next question was going to be, Mary, has there been any significant statistical uptake? So that's you managed to answer that one quite neatly. Thank you.
Telepathy.
I know it's the best way to deliver questions, although it threw me a little bit. Sorry. So somebody has actually asked a very good one, which is great because it's for all the panel. Is what are your sort of personal top tips for staying well from a mental health point of view, and sort of talking, I guess, more from a sort of prevention point of view, because like I said earlier, we're acutely aware of the fact that for surgeons, the pandemic in its original state might be over, but the work is potentially yet to come. So people are asking for sort of top tips and ideas of ways of helping themselves keep well.
Shall I kick off? Electric bikes are fantastic. And if you can, cycle to work, cycle home, because then you get it fitted in. That's my top tip. But then there's all sorts of other stuff about working with a team better, kind of sharing ideas so that you really are genuinely working as a team. We've got doctor's assistants in my trust, so they take on that admin burden that Mihaela was talking about, so that you can get on with the job. So it's kind of working out what skills people need and what they're there for, and working together well. Mihaela, do you want to add yours?
Yes, of course. Thank you. I think on a personal level, I started to pay more attention to the time I spend in nature over the last few years. And I always go for a walk. Of course, having a dog helps, so I have to go. But it's something that gives me so much joy, and I really value this. As a consequence, I also developed an interest in nature photography. So I tweet every day, and it's great to see how I through an interest which is not necessarily related to the day-to-day job. I connect with so many doctors and colleagues from all over the world. So that is something that nourishes me to a certain extent, and I really enjoy it. Another aspect and another point that is important, and I try to be very active in relation to that, particularly during the pandemic, is to maintain my connection with peers. And sometimes we feel, of course, we are very busy, or we work from home at times, or work in a busy clinic, and we might not feel well. It's difficult to call someone just to find out how they are. So I think becoming isolated ourselves or seeing others becoming distant is something that we can all change and make a difference. So keeping the relationship with colleagues, it's really important. I guess, as Mary was mentioning earlier, one of the benefits, I may say, of the pandemic is the fact that we discuss nowadays more openly about self-care, about well-being. We brought this, I mean, it's normal, we have our own vulnerabilities, but we brought more at the front for the human aspects, our humanity. And it's something that probably we would have not been so open about it 2-3 years ago, in terms of discussing about well-being and getting support. So I think that's positive. I think we need to build on that. So it's good we discuss, but also we need to act and use the resources that are there and make the most of them. And I think we need to learn to have a better level of self-compassion, and we are all on a journey in a way in relation to that. And I think that's important for us, but also it can be a model for the people around us, people in teams, and particularly for medical students or the juniors which are working with us, but also for the wider team. For example, yeah, in my team, we used to go before the pandemic, and we just restarted to go together for a well-being walk, half an hour before we start work. And I think it brought us together in ways we didn't expect. Yeah, very positive.
Thank you. Martin, any final tips?
From a personal level, eat well and cook fresh. I think one thing I've learned is to, I've prepared such a variety of meals throughout COVID that I wouldn't have necessarily had the time to do before. And so much so that I don't know if I want to kind of, eat out as often because I'll be disappointed. And I didn't think that would happen. But in doing so, it's been an opportunity to sit down and talk more, a bit like you're saying, Dr. Bakur,
yeah.
and share kind of your experiences with your day, particularly after for all of us working from home, if we're doing quite a lot of Zoom meetings, actually getting offline and sitting down and cooking, having that conversation with your family is so important. Professionally, one thing that I took this year, and we spoke to Dr. Alex George at our conference on well-being, is to actually ask each other, how are you? There was a very prominent campaign, Hello, my name is, and something kind of we've taken from this year is hello, how are you? Because we don't understand, even as surgeons, when we get a referral from someone, is that person struggling or whatever, and just take that, moment when it's safe to do so, but to ask, how are you? And I think those are very basic but very important things that I think we've all become more cognizant of, and certainly I hope to kind of maintain that. So yeah, that would be all I would say.
Thank you. That's lovely. Mary, any last tips?
Yeah, just a quick one from me. Those are all brilliant. I think something that I've learned this year is that for well-being, it's not for just when things are going badly. So you need to be doing all of these things even when you're feeling at your 80%, 90%, 95% feeling great, but actually that's not the time to let some of these things slip. So it's using those all of the time.
Brilliant. Thank you. And we'll probably leave it there then, I guess, Jane. I just wanted to highlight this, Royal College of Surgeons of England confidential support and advice service for surgeons, which we've just expanded. So there's support there 24 hours a day. If you just screenshot that phone number and keep it available, or you can find it on the website. And it's basically trained counsellors, but they'll refer people on to trained peer-to-peer surgical advice when needed. So do use that if you need it. It's quite a new service. We just we haven't got the statistics on it or anything. It's just see how we go, but it's there for you, for our members and fellows. So thank you, and thank you everyone on the panel. As I say, it has brought out some good things and brought people together and made people more aware of the importance of looking after themselves and people around them and the team. So I'm hoping we're going to move forward to somewhere better than we've been in decades past, should we say. So, but thank you very much for everything you've contributed.
Thank you.
Thank you.
Thank you. Thank you.